Well, Dr. Sarah Taymorian is here today. She is a internist and geriatrician with the Senior Care Medical Associates. You're right across the way here. Nice to have you here.
Thank you. Thank you for having me. Yeah, our group is in the Taj Mahal building, right on the bus line here in Laguna Woods. I'm one of 6 physicians at the group, and our group specializes in senior care, geriatrics, and primary care.
Now, you were telling me right before we start here, you have been with them for a few months. They've been around for many years, though, right?
Yeah, the group has been around 10 years, the 5 core physicians that are still in the group. I joined in July of 2014, so just coming up on about 8 or 9 months in the group.
Prior to that, where were you practicing?
I was doing primarily home care in Laguna Woods and South
really?
County through the Monarch Medical Group.
Sure.
Yeah, which
All
we're
right.
still we work closely with Monarch through senior care. We're an exclusive Monarch provider.
All right, and we certainly know Monarch well here. We do their Senior Focus show.
Right.
So, have you ever been on? Have you been on that
I
show
was.
before? Okay.
I was.
All right, then I have met you before. There's a few things here that you want to focus on, and one of them is pre-operative office visits for older adults.
Right. So one of the topics I wanted to bring up is I think a lot of older adults in the community may not have a primary care physician or a regular internist they see because they may just have a few medical problems and focus on seeing subspecialists. But often a good opportunity to meet a primary care physician or to get one for the first time is prior to having a big surgery. So for example, a knee replacement, a hip replacement, sometimes even a cataract surgery might be a good reason to meet a primary internist or family doctor for the first time to have what we call a cardiac or pulmonary assessment prior to undergoing a big surgery. And part of that is to help reduce your risk during and after surgery so that can be a very smooth process during the recovery time. And some of the things we focus on is your heart health, your lung health, screening for any medical conditions that might complicate surgery, things like diabetes, heart disease, lung disease. But then also after surgery, some of the big things, especially in older adults that are important, is pain management after a big surgery, rehabilitation, physical therapy, and also sometimes delirium or confusion can be a complication of surgery. And those are areas that as primary care doctors, we really focus on, and as a geriatrician, I particularly focus on for older adults to help make that surgery as smooth as possible. So we work with your surgeons to prepare you.
Yeah, I think that's a very good idea, and I'm sure also just looking at the type of medications they may be on
Absolutely.
and relating that to the surgeon is very helpful because they may not be aware that they need to do that, and perhaps the surgery team, the specialists there, didn't ask. I'm sure they do, but having someone that can look at that and really relate on a medical level is far more productive, I would think.
Exactly, that's a fantastic point. Often the medications before and after surgery may get left off. You may have been on 3 diabetes or blood pressure medicines before surgery and they forgot to restart them after. So that's a very important area of continuity that a geriatrician or primary care doctor can help provide.
And you also do cancer screening, right?
Yeah, so cancer screening, in all adults is important. There's things like skin cancer screening, breast cancer, colon cancer screening, cervical cancer screening. But as we get older, the cancer screening recommendations change. And we, as a practice at Senior Care, and specifically as a geriatrician, I try to tailor those recommendations specifically for older adults, and not just apply the same screening methods to everybody as we get older. So for example, a lot of older women come in to ask about breast cancer screening and cervical cancer screening. So we really try to focus on that individual's risks and their life expectancy or prognosis before we just throw recommendations at people that may not apply.
Okay.
So that's something that we work with for people on their regular physical exams or yearly assessments.
When you do these screenings, I think most of us would understand for breast cancer screening what that would be.
Right.
But for general screenings, colon cancer, you have the colonoscopy.
Yeah.
Is this what you mean by screening, or is it more you sit down, you get their medical history, and things like that, and then if needed, you may take it to the next testing level?
That's a great question, because screening shouldn't just be ordering a test for something. Screening should be learning about their individual risks. So for example, family history, personal history, but also current symptoms that patient's having.
Okay.
For example, bleeding, weight loss, or other specific changes that are relevant or not relevant, and that will help us decide which tests are appropriate for that person and really tailor their screening to make it individual, to really honor that person's goals and wishes, rather than just sending a card in the mail that says, hey, it's time to get your colon cancer screening. Because there's some 97-year-olds that don't want to do a colonoscopy anymore.
Who does? Who does? You also are involved in hospice and palliative care medicine as well, right?
Right.
And this is obviously a very specialized area.
Yeah, so one of my areas of training was a hospice and palliative medicine fellowship that I did at Stanford a few years ago. And I really completed that fellowship to make me a better geriatrician and internist. And what that area of medicine really looks at is for people with advanced or serious illness, whether it be cancer or advanced heart disease or lung disease, specializing in helping promote comfort and quality of life during the course of their regular treatments or surgeries.
Yeah, obviously it's it can be a very difficult time for people, and as we have learned on this program before, that just because someone goes into hospice doesn't mean that they're on that road. They could successfully go through hospice for weeks or months and turn out that they're doing quite well, right?
Yeah, one of the interesting things about hospice is we have a population of people that we call hospice graduates, people who defy medical odds and survive even for years on hospice, and ultimately can graduate from hospice. And I think that just speaks to our the difficulty sometimes knowing how a person will do, that they'll improve.
Yeah.
Sometimes when we withdraw aggressive medications or other things, people actually improve. And with good supportive care, people can get better and really thrive.
Yeah, we've seen that happen. How, if someone is looking for a primary care, an internist, I have, I'm going to give the number. It's 949-588. You can go SCMA or 7262, but it's also seniorcaremed.com. Give your office a call, and they can request you, or is that how it works?
They can
or go on the website, of course.
Exactly. They can go on the website to learn more about the different doctors in the practice, and call our office to schedule a new patient visit. And we'd be happy to help serve the Laguna Woods community. That's why we're here in Laguna Woods, and we love working with all older adults and younger adults too.
And obviously you work with all the Medicare programs and things like that.
That's correct. We work with Medicare, and for the Medicare senior plans, we work primarily with Monarch HMO plans.
Okay, very good. Great to have you on today. It was great seeing you again, because I do remember when you were on the Monarch program. And again, it's seniorcaremed.com, and the number is 949-588-7262 or 588-SCMA, Senior Care Medical Associates. You're right in the Taj Mahal,
That's right.
So it's just a quick little trek right over there. And as you can see, Dr. Teymoorian is very experienced, her background in working in this field. And give her a call if you're looking for a primary care or just a change. She's there for you. And I appreciate you coming on.
Thank you for having me. It's
All
always
right,
nice.
and say hi to your husband.
I will.
All right, we'll be right back.
Thank you.